Welcome everybody. Pleasure and honor to be here and to talk about what my passion and my purpose is, and what I've spent so many years studying is looking at the immune system. And it's, in essence, our group, ReStem Group, is restoring the immune system to a younger state. So I always love to talk and start my talks with the basic functional unit of life, which is the cell. There is nothing more important in life than these trillions of cells that we actually have in our body. What's even crazier is the amount that turn over on a daily basis. We have over 300 billion cells that turn over on a daily basis. So cells are the building blocks for everything. The neat thing about them is they require communication. So these are done through specific secretory vesicles. A cell, and every cell in the body, produces a signal and then communicates to its partners, just like we communicate with everybody that's out there in our own individuals. They actually secrete the cells, the 3D matrix that were composed of the 3D matrix that we hear in right now. They do this on a daily basis. It's to sustain life and to help us live long, healthy lifespans. Our company, our vision, and our focus has always been delivering novel, industry-leading cell-based regenerative therapies targeting more than anything else age-associated disorders, making them available to everybody at affordable costs. We first and foremost look at safety, and we're going to talk about all our different programs that we have relatively soon. Our focus is aging. If you look at everything in the context of aging, is everything deals with our cells. So if you look at what you're trying to do, is you're trying to stop a cardiovascular disease. You're trying to stop the osteoarthritis when you hit 40 years of age. Standing longer makes it harder. For those of us that are actually at these conferences, they're difficult. I mean, it's difficult to stand up all day long. Individuals that work a lot. When you age, it becomes... We're focused on the immune system because we want to reduce that inflammatory response. We want to reduce the immune burden that happens. Age-associated diseases such as cancer, neurological disorders, cardiovascular disease, metabolic disease, they're all dictated, believe it or not, by what? One thing, the immune system. Our company history has a strong foundational history of over 16 years of research and development in the space. Our number one platform is our umbilical cord lining stem cell, which targets age-associated disorders. And then secondarily to that, we have a patented next generation natural killer cell therapy platform that clears those age senescent cells and help you restore immune function. We're gonna go dig a lot deeper into all of these, and I'm gonna show you a lot of the science behind all of it in just a minute. So our three therapeutic programs, number one, the patented umbilical cord lining stem cell targeting age-associated diseases. We actually have multiple ongoing clinical studies here in the United States with that are FDA approved. Our patented ULC-derived secretome or exosome products, for those of you that don't know what an exosome is or what a secretome is, we'll explain that in full detail and you'll get exactly the knowledge that actually helps you with age-associated diseases. And then most importantly is our patented next generation stage natural killer cell program that targets killing those age-associated cells and actually age-associated disorders. So starting off with number one, everybody's heard the term stem cells. What are stem cells? What they do? Everybody knows about them. It's like one of the new hottest things. The difference is our umbilical cord lining stem cells have a significant amount of research behind them, packing them up. If you look at actually these charts right here, you will actually see a blue graph, a red one, and a green bar. And what we're looking at is actually our umbilical cord lining stem cells. Everybody's familiar with telomeres. Telomeres are part of associated aging. As you actually age, cells, basically telomere lengths decline. Our cells are much higher, have much higher telomeres. They're younger, more robust than that of any form of fat stem cell or any form of bone marrow stem cell. You can see that clearly with the blue bars, even as they've aged artificially, because we age these in a petri dish. We do this naturally, and what ends up happening is even if you look at what's called this P6, which is about a couple months of aging, you still look at a cell that's much younger and robust than your standard fat stem cell or your standard cell. Looking at it graphically is how many cells we can actually produce, how many of these young, robust, healthy cells we can actually produce. You the green dots that go straight up, that is an exponential curve on the amount of cells that we can actually produce. And our technology dates back to a really, really interesting thing of we can produce robust young cells, much better than any fat or bone marrow mesenchymal stem cell. If you look at it in the context of stemness, what's called stemness, reproducibility of a stem cell, we normally look at clones, how a cell can clone itself, how a cell can replicate itself. We look at these dishes right here, and you see the bar graphs next to it representing the counts of being able to produce cells. You'll look at the bottom plates on there. There's a lot more of those little colonies, and there's a lot more stemness, what's called stemness, the ability to replicate, the ability to do what's needed to do in a stem cell. Our product, ReStem, has many advantages over others, fat mesenchymal stem cells, bone marrow mesenchymal stem cells, even other umbilical cord products out there that are just meshed up umbilical cord, where the potency is very, very high and rich source of growth factors, nucleic acids, cytokines. It avoids any form of immune system detection, which is what we want to do when we talk about the immune system. And we already have established a safety profile. We have a fantastic manufacturing capability of having this as an off-the-shelf, and we have superior lot-to-lot consistency in what we have. So we actually have, our umbilical cord platform that's actually in there. For our plan is to actually go into routine clinical care. The properties of our cells are superior to bone marrow, superior to fat. The neat thing about our technology is we can actually take a segment of cord that's about 4 inches in length, and from there, we can actually produce 1 million doses of 100 million cells that are that of biological age of about 15 years of age. Think of this, when you were 15 years old, how well did you feel? How well did you recover? How well did you heal? That's exactly what we're bringing to the table with our product. The studies that we actually have in the United States that are approved, we actually have 23 approved investigational new drug applications, and we have presently 4 clinical studies, of which 3 are going into phase 2. We have a phase 1/2 that was acute respiratory distress syndrome that's completed the phase 1. That's going into a phase 2 actually for something a little bit different, which I'll describe in a little bit. We completed our phase 1 polymyositis, dermatomyositis, which is a brutal autoimmune disease that causes pulmonary fibrosis essentially. We're going into phase 2 for that one. We have a heart failure, bleeding due to left ventricular assisted device, that just completed a phase 1 study, and we published a paper with this study that's in the Journal of Heart and Lung Transplantation, which I'll show you next. We have a Duchenne's muscular dystrophy that's pending initiation, and we're switching gears on the COVID, going into actually long COVID and the many people that suffer from chronic fatigue syndrome. And then our plan is for next year, Q2 of 2024, is we will go into a phase 2 for rheumatoid arthritis, targeting on things that deal with the immune system. We just published this paper Monday of this past week, intravenous administration of umbilical cord lining stem cells in left ventricular assisted device recipients. These are the results of that phase 1 study, where we clearly demonstrate safety, and then we also demonstrate some efficacy in the context of the study. The study's in conjunction at University of Florida, where we're actually going into our phase 2 studies also over there, and we're going to have a multi-center study with this. So our product pipeline currently right now, as I just described right now, we have everything I described: the COVID, the autoimmune disease, polymyositis, dermatomyositis, a heart failure study, long COVID study that we're actually going into, Duchenne's muscular dystrophy, and then soon to be a phase 2 in rheumatoid arthritis. Our potential futures that we're also talking about, because we've been fortunate to be able to do what's called compassionate use cases here in the United States, is we want to look at a lot more details of multiple sclerosis, other autoimmune disease, and neurodegenerative diseases such as Parkinson's, because we have seen with the investigational product that we actually have, we have seen some preliminary efficacy in doing case studies with this. Autoimmune disease, keeping on with that, is RA, lupus, and then somehow going into wound care, burns, which not only this product, another product that we have, and ischemia, stroke. Ultimately, what we're looking at is a product. Our product, we know, helps regulate the immune system. It can actually increase the anti-inflammatory healing response and decrease that pro-inflammatory response that actually causes chronic inflammation and actually causes aging, premature aging. We're going to shift gears now significantly, and I'm going to show you how we target aging in general. I just talked to you about stem cells. I talked to you about a product that can help regulate the immune system and what it does. Does everybody here know exactly what are the 3 cell fates in your body? Your body has, the cells in your body have three things that they will do. One, natural cell death, which is called apoptosis, and it occurs billions of times on a daily basis. Two, necrosis is when you have an injury, when you have a blunt trauma, when you have anything like that. The cell lyses, ruptures, the immune system picks it up. But three is our target. Three is our big target, which is a senescent cell. It's also called the zombie cell, what a lot of people notice it as, a zombie cell. And why? Because every cell in our body has a finite amount of replications. A senescent cell, look at it in essence as this gray hair I have right here is essentially a cell that's not able to produce the right pigment. The wrinkles of our skin is also a senescent cell that's not producing the right amount of collagen, the right amount of elastin, the right amount of HA. This is a cell that occupies space and actually causes havoc. And it causes havoc by signaling nearby other cells that are around there and causing havoc with cells that are actually healthy, believe it or not. It's because it produces the wrong signaling cues. So what we're talking about here is NK cells, natural killer cells. Natural killer cells are in charge of three things, and we'll talk about them shortly. But they are part of that immediate immune response. They are the initial targeters of actually doing any type of killing with virus, cancer, and a senescent cell. That's if and only if they're activated, and if and only if they're not old. So that's one of the issues. But they actually also work in conjunction with what's called our adaptive or our secondary immune response, which is all the T cells and the B cells. They actually activate them so they can further they're basically like the army. NK cells are a little bit of what we would call sort of like a orchestra, the lead of the orchestra, and actually the conductor that helps conduct the secondary. So what do we actually do? We actually use your own NK cells. We activate them. And actually from anywhere from about 20 million to 50 million cells, we start off with that amount, which is about 150 cc's of blood or 150 mLs of blood. We take that, and once we've actually taken that, we then grow up and expand, activate, and culture expand anywhere from 1 billion to about 3 billion NK cells. These are then activated. These are actually put back into you, and I'm going to show you what they actually do in just a second. This is a 24-hour phase lapse microscopy image that actually we compressed into 4 hours, then actually later compressed into 4 minutes. So everybody's like, oh, what am I looking at? What you're looking at right here is those black, long, elongated areas, which some of them you can actually see the nuclei within the cells. These are skin fibroblasts. So these are skin cells that we've actually aged artificially in a petri dish. Now, what is all those white dots everywhere? Those are natural killer cells. And what we're actually looking at is an in vitro experiment. Now, if you look right at around the bottom left-hand corner, you'll start to see aggregates of NK cells, because NK cells, what they actually do is they will target and kill a senescent cell. I'm going to show you the proof that they target and kill senescent cells, these aged zombie cells. How do we know it's a senescent cell? It's because the bigger they are is when they actually look senescent. Actually, essentially, when you grow up cells, you'll start off with a young, robust cell that's really small. And then with time, as you multiply them, exactly what happens to us when we age, we gain weight, we internalize fat, we get bigger. Our cells actually get bigger. So this is what you're looking at right here. You're looking at about the bottom left-hand corner, and you'll see this big white blob that's forming right there. And take a look at what's happening right now as we speak. Look at that cell right there being picked up. And it's being picked up, it's being picked up, it's being removed. Look at that. It doesn't get more proof than that of removing senescence. We have now removed right there 2 old senescent fibroblast cells in vitro in a petri dish. The neat thing about it is you think about this, okay, the cell's no longer there, what happens? Well, guess what? Your body now has the correct signal to say, I need to fill that void because the body has a certain amount of cells in it. It has to produce a young, robust cell and regenerate now. So we saw that right there, and then pretty soon you'll actually look to the right of that, and you'll see that happening again. But ultimately what transpires is NK cells are sort of like a gang. And there's anywhere from 3 to 10 of them that will gang up on a bad cell. It can be a virally loaded cell. It could be these zombie cells that we just talked about, or it can actually be a senescent zombie cell that is what causes havoc, and we now know even causes cancer. There's evidence now that these cells, they've stopped replicating, they release the wrong signaling cues, they cause cancer too. So if we continue on, we'll see a little bit more being cleaned up in that little area right there. And if we continue the video, which is a 4-minute long video, you'll see some other cells actually being cleared out too. But this is clear evidence. When we found this after 4 years of producing NK cells, of 4 years of studying this, if you would have seen me and my science team high-fiving and showing that what we've done is produce an activated NK cell and we're able to remove senescence, it was like a big target. That led to this right here, which is one of the most important things that we've actually done in years, and the patents that we have actually behind this. Autologous NK cells propagated, this is an important part, grown and activated ex vivo, meaning outside of the body, can decrease these zombie cells, senescence markers, in human peripheral blood mononuclear cells. That means actually so human immune cells can be decreased or removed. The bad cells in your immune system can be decreased. Where's the evidence of such? We actually looked at 2 different cohorts. I'm going to show you cohort 1. These are 3 different donors, and the interesting thing is look at bar graph number B, the blue one, and look at A and B. These are 2 different markers that we're looking at. Number 1 is, you'll see on the left-hand side, P16. What is that? P16 is actually a protein in your body that deals with turnover of cells, or it's a cell cycle checkpoint protein. It is the protein that tells the cell, divide, don't divide. Now look at the blue bar you'll see right there. That is that of a 71-year-old. The higher the P16 is, the older you are, the more senescence you actually have. The next bar, which is the orange bar, is actually a 51-year-old, and then the one below it is a 41-year-old. So this is clear evidence that this is a protein that deals with senescence, because the older you are, the more senescence you have. Now, we did a treatment right post day 0, and then you'll look at day 14. Look at where that cell cycle checkpoint, we've eliminated those senescent cells. And then if we look at day 90, it increases. It starts to head back up because senescence will build up again. And then we looked at how do we support this cell cycle checkpoint. We look at now what's called beta-galactosidase, the most well-known marker for senescence. It's an enzyme that's right on the outside of the cell, sits there, and it's the way to identify a senescent cell. Look at the same exact thing supporting what I just showed you. Look at the blue bar on the 71-year-old. Look at the 2, the 51-year-old, and actually the 41-year-old, which the 51-year-old had a similar amount of senescent cell than that 41-year-old. And we'll talk about why in just a second, which is serendipitous. We got some really interesting data on it. You look how it dips down in day 14, and then it increases back up, especially in the context of the older individual. What does that mean? That means if you reinfuse the stuff, which is cohort 2, where we put 2 billion cells in them, and we reinfuse them, this is a 53-year-old and a 54-year-old, and this is published data you're welcome to look at. There's a lot more of this data out there on this publication, where we started off at day 0 and look at both what's called the P16 and the beta-galactosidase, and you look how elevated it is on both of these individuals, donor D and donor E. And then they were treated, and then we actually looked at 56 days after. You'll see a significant dip in the senescence. Then we look at day 192, which is over 6 months out. They are still not at where they started off with their senescence, because these guys got 2 billion cells versus the first cohort got 1 billion cells. Then we reinfused them with 2 more billion cells, and we took it out 267 days, and we see that there's a longer lasting effect. Following this actual treatment, we've actually done with this same exact cohort several reinfusions, and we now have data that we can actually show you out that the more frequent you do this on a 6-month basis, the longer it lasts. Serendipitously, what I was telling you about that first cohort on that 41-year-old is the individual reported, we looked at safety, we looked at toxicity, and then of course we did what's called quality of life surveys. And we asked the simple questions on how do you feel, what's going on. We looked at 50 different cytokine panels. We looked at many different markers out there, inflammatory markers, full inflammatory markers, liver enzymes, kidney enzymes, CBC, all the different tests that you normally do. Patient that's 41 years old had reported to us that he has inflammatory bowel syndrome. Then after that, when we spoke to him, he said, there's something interesting because I'm having no gut issues. I said, what do you mean you're having no gut issues when we looked at the survey? He's like, so much so that I'm actually able to eat something I was not able to eat before, tomatoes, onions, and hot sauce, which is interesting. So we actually had stored serum, stored cells from this patient. We went back, looked at the literature, and said, we need to go back and look at markers of inflammatory bowel syndrome. Now, if you look at IL-6, everybody here knows that it knows the inflammatory field. It's one of the strongest indicators of aging and disease, inflammation. You'll look at panel C, look at his IL-6, how elevated it was before, and then look after. Most importantly, IL-27, IFN gamma, IL-17. Look at his before and after the treatment, what transpired. This is an individual who's now cleared for over a year and a half with no issues of inflammatory bowel syndrome. So this is clear evidence that we have also cleared the senescent cells, clear evidence that we've actually now also controlled in the context of this one patient. It is only one patient. We need a lot more data. We have to do more studies. But that we possibly did something to his gut microbiome or to the inflammatory system within the gut. So right now, our focus is actually taking this full platform forward in the context of aging frailty and looking at senescence, also based on that evidence that I just showed you right now, looking at this in the context of autoimmune disease and of course age-associated sarcopenia. So our aging plan, what is it in ReStem? Number one, if you think about this and you think of the science behind it, what do we want to do first? We want to remove those aged cells, senescence. This is done through our platform with NK cells. What do we want to do secondarily? We want to regenerate and we want to regulate the immune system to keep you healthy for a long time. That's our umbilical cord platform, the umbilical cord lining stem cells that we have. Number three, everybody's interested in actually, I feel good inside, regulated my immune system because there's nothing more important than that. I want to look good outside. How does ReStem do that? Introducing congenital, which means essentially in Spanish, it actually means freeze time. And our product Juvexo is actually derived from the umbilical cord lining stem cells, where we spend years researching this and finding ways to help skin look phenomenal. So we've actually penetrated now the medical aesthetic space, where this is sold directly to dermatologists, sold directly to estheticians. And why is it used? It's actually used, believe it or not, following microneedling radiofrequency, used following CO2 fracture laser, used during electroporation, dermabrasion devices, any of those, because when people get these things done, they have a significant downtime. They look really bad. We reduce that downtime significantly, and we improve appearance with this product. A simple product that's thawed, sprayed on, atomized on is the way we use it, and it dries immediately. Individuals that are normally out following CO2 fracture laser chemical peel, they're normally out 7 to 10 days. Not when they use Juvexo. They're outside in about 2 days. Evidence of such, we studied this dating back from 2014. The interesting thing is, just like diet, what you take in on a daily basis is the most important thing that you can actually do. The diet we give ourselves is our proprietary formula, where we studied what you see. U is the umbilical cord, B is a bone marrow mesenchymal stem cell, is a comparable, and what we look at is two things: what is inside the cell, then what's outside the cell, and what do we need to feed the cell. That's why you see 1, 2, 3, 4. Those are different feeding regimens, looking at different foods to feed them. What is produced inside the cell, then what is secreted outside the cell, because these are the communication vesicles that we need to capture for Juvexo. Take a look at the really, really interesting data where it took us a while. I mean, the science was crazy behind what we were doing. We were registering glucose strips on a daily basis to these cells, making sure that we weren't giving them too much glucose, making sure that everything was under control. And then finally we found this program working with Cleveland Clinic, where we looked at hyaluronic acid and we looked at chondroitin sulfate. And we found this particular formula that is an amazing formula. Not only that, we took it a step further. What does this do to skin? We actually took skin fibroblasts once again from a 53-year-old and then also that of a 25-year-old, and you will look at what we put as secreted, meaning what is outside of the cell, and then stored, what's inside the cell. When you see the 0% UCM, that's a umbilical cord matrix that that's the way we call it, you will see we put these cells on a plate. We then actually feed them either 5% of our product or 20% of our product, and then we remove it, we wash these cells, and we look at what's being produced. When our product is not on there, guess what? There's no collagen production or not detectable collagen production from the skin fibroblasts, whether they're 25 years old or 53 years old. When we put 5% of our product, take a look at how much collagen your own cells are producing. We're stimulating collagen production. Take a look at the elastin, your own elastins being produced. So you can look at it in the context of what's inside the cell and what's outside the cell. Clear evidence of a change in actually skin, of course. Next slide. What else is in this product? A neat thing that we found is a lot of people that had these procedures done, blemishes, acne, they talk about complete clearing of the skin. We found this out serendipitously that the product has something, a peptide called LL37, that's naturally released from the cells. That's one of the strongest antimicrobials that your body actually carries on a regular basis. And it has the right levels of it. Not only that, we're talking about 1.3 micrograms of high molecular weight hyaluronic acid. When you look at cosmetic, what are you looking at? The three key factors: hyaluronic acid, collagen, and elastin. That's what we need for success. And when it's naturally occurring, when it's naturally produced, and it's organic, we're not adding any of it on, and it doesn't break down, because the vast majority of the products that are out there that have HA are, guess what? Low molecular weight HA. This is what we have. Also some other inflammatory, anti-inflammatory proteins that are in there, other mitogens that are in there. This is the key to success to this actual product. The product is suspended in, it doesn't get better than this, full amino acid, full vitamins, biotin, folic acid, niacinamide, vitamin B12, thiamine, all the different amino acids, glutamic acid, all the different things that are needed for success. This is the basis formula of what we've been producing for years, like I said, dating back to 2014. So we're talking about 9 years now in production. Everybody asks the simple question of, what is in there? How many exosomes are in here? This is actually using a nanoparticulate device that you count how many nanoparticles, because exosomes, those bioactive molecules, are nanoparticles that are 1/1000th the size of a cell. So what we normally do is we use a device that reads nanoparticles, and you can do this device without a dye that goes onto that lipid bilayer of the exosome. Do it with or without. When we do it without, we're talking about almost 1 trillion particles per milliliter of product. But when we do it the right way, or we incorporate the dye that only binds to the lipid bilayer, we have almost 50 million particles per milliliter in the context of what we describe as exosomes. So we've actually talked to you about aesthetics and cosmetics. Next, I'm going to talk to you about, if you think of conceptually what else this would be good for, joints, orthopedics. That's our next step, actually going into this space of, what is the knee made of? What are joints made of? It's predominantly, the synovial fluid is predominantly hyaluronic acid. It's the cushioning that is there. We are actually going after submitting an application for this product to the FDA for orthopedics, looking at osteoarthritis, because we need that supplementation within the joints, because not only do we have the HA, do we have the collagen, but we have the factors that can deal with healing and repair. That's our approach next with this product. And this is actually our plans to go into it. We're actually going into an investigation on new drug application for this in osteoarthritis, and secondarily to that, because it's so easy to use topically in wounds and burns. So our aging plan, once again, we've now showed you that we can remove senescence. There's nothing better than that. Number 2, we now showed you that we can regulate and regenerate using umbilical cord lining stem cells. And number 3, we're now telling you that we can make you feel phenomenal, get younger on the inside by bringing our immune system to a younger state. And now we're actually talking about you can actually look good on the outside using cell-based mechanisms. What else do we do? We are, like I said, a cell therapy based company. We've partnered with some places outside of the United States. We actually have 2 clinics and lab in Cancun where we actually do current good manufacturing practices. Those actually are our lab right there. Those are actually live personnels on these images. These are our labs. So we do, next slide, quite a bit of work in the context of regenerative medicine, what we just talked about, cell therapies, and actually natural killer cells. We also work in the context of, for children, autism and neurological disorders, which is World Stem Cell Clinic. And most recently, within the past 3 to 4 years, we've picked up this phenomenal program from a company called Immunosine. Immunosine is actually a Baylor-based technology that it's actually a dendritic cell vaccine. What is that? People don't even know what that is, because this is cutting-edge, precision-targeted medicine towards your cancer. An individual comes in with metastatic cancer tumors or an individual tumor that's relatively large. We pick up and biopsy that tumor. We isolate the protein. We isolate the message of it. We then remove dendritic cells from that individual. These dendritic cells are what's called the protein or the antigen presenting cell. They are the lead in your immune system. If you look at them when they float around on a regular basis, they somewhat look like this. When they get targeted with a virus, when they pick it up, chew it up. When they get targeted with a cancer protein message, they chew it up, and then they go into this formation. This is the formation where the ends of my fingers are basically that message and that protein that can now go and tell your T cells, your immune system, hey guys, I need you to build that army and I need you to attack and kill this cancer. This is full precision cancer therapeutics. It doesn't get better than that. Besides that, we've also picked up from another company that's UCLA based, a supercharged NK cells that's primed directly towards cancer, where we recently did our first 2 patients in Mexico. So in essence, we are a true cell therapy company looking at all the aspects of aging, whether it be aging naturally, aging in cardiovascular disease, slowing that down, aging in the context of neurodegenerative disease, slowing that down, natural aging, osteoarthritis, all of that, slowing that down, stopping that, preventing it, finding ways of doing it. And then secondarily, as we age, we're so much more prone to get cancer. When you're 50 years of age, 50% chance of actually getting cancer. Our target is getting rid of it, removing it, living a long, healthy health span. And with that, I thank you guys for your time. Thank you.